For an average family of 4, this year's number is $23,000. That's what a typical American family insured that way costs.
And they have this false sense of security that they're in a plan that provides them protection. But regrettably, all too often, people find out when it's too late, after they've been sick, after they've been hospitalized or injured and requiring expensive treatment, that their coverage was not nearly what they thought it was. And insurance companies are able to charge older people 3 times as much as younger people for the exact same policy.
Their potential employer sees them as a risk.
The age 50 to 64 age bracket includes very high rates of uninsurance within the U.S. market, and it's because these are very expensive employees.
It makes it less likely that employers will even consider hiring someone in their 50s, for example, or early 60s. I've talked to people who've told me they've not gotten a raise in 5 years because the money they would otherwise have gotten in raises has gone to insurance companies.
We've created a very fragmented system in which coverage is tied to employment in ways it isn't in most other countries in the world.
If you and your family lose their whole health insurance because of a change in your employment status, that's an incredible insecurity, an incredible burden for families to have to bear.
So the whole idea of having insurance that protects us from financial ruin, it just doesn't exist anymore for most people.
And this is why, of 1 million bankruptcies in the United States, over 60% are associated with medical conditions. And the great majority of those are people who have health insurance.
We went through years of working hard only to lose everything. Lose our home, go bankrupt. What a shameful thing to do to people.
Healthcare costs have gone up to $3 trillion.
We've gone from 7% of the economy back in 1971 being healthcare to 18% today.
When the rest of the world is spending less than 10% of their economies and getting health care to all of their citizens.
There's been a reduction in consumer purchasing power that can be directly associated to the increase in medical costs in the country.
We're here at the Bethlehem Wastewater Treatment Plant here in Bethlehem, Pennsylvania. And this piece of equipment behind me is a 40-year-old piece of equipment that's been basically taken out of service. We've got a rental unit that we now pay $17,000 a month to lease that piece of equipment. So that $17,000 of additional cost monthly expense is going to get passed on to the sewer customers in a form of rate increases. And this plant in general is just one small example of what the true impacts are of the spiraling costs of healthcare and our inability, whether it be here in the city or as a country, to address the infrastructure needs that we have throughout this country.
I remember 35 years ago when healthcare was affordable. MCS had great insurance, full coverage with minimal deductibles. U.S. employers across the country provided well for their employees. No worries. That's all been eroded by a relentless increase in healthcare costs. Today, there's a dark cloud of anxiety in the country, a dark cloud over our employees. They're one diagnosis, one accident away from financial disaster. A few sick employees can take down a company. The dark cloud hangs over our cities. No money for infrastructure, no money for schools, high taxes. That dark cloud hangs over our whole economy, causing flat wages and no money to spend to fuel real growth. It's a problem that we have to solve.
It makes me angry to see so much waste in healthcare, that there are nurses who are pulled away from actually providing hands-on patient care, and they're pulled into administrative duties. And they're pulled into those duties because we have an incredibly complex billing system. We have many different payers in our billing system. We have people who can't pay, people who have this insurance, people who have that insurance. So there's nurses whose full-time job is to help get authorization so that a patient can get the care they need. And that's ridiculous.
MCS pays $1.5 million a year for its health insurance. And where does it go? 3 cents of every dollar goes to an insurance agent that represents MCS in selecting an insurance plan and negotiating price. The next 20 cents of our premium dollar goes to the insurance company for its sales and marketing expense and for its staff to pre-approve and deny care and its administrative expense. And then you have at the provider level 10 to 15 cents that goes to hospitals and doctors to interface with my insurance company. They face massive amounts of paperwork and phone time dealing with pre-approvals and denials and payment issues. None of it is related to care. That's 33 cents of our dollar before the actual cost of care is paid for. My insurance company is supposed to negotiate better prices from the providers, but on average, they end up paying 20% more than Medicare does. They pass that extra cost on to my company. I don't see what private insurance brings to the table.
What keeps insurance company CEOs up at night is the worry that other CEOs that will eventually come to realize that they add more cost than value to our healthcare system.
Over and over again, we're hearing the same plea. The system is too confusing. We need to have simplification to control cost and to improve quality. And what about single-payer health insurance? What does it mean? One entity that pays the bills. We get rid of the hundreds of complicated insurance plans, and we have one comprehensive plan that covers everybody. It's simple and efficient. You go to any doctor or any hospital you want, present a card, and you're covered. There are no deductibles, no out-of-pocket expenses, and no contentious pre-approval before treatment. Everybody is covered. Nobody is left out. Single payer is not a government takeover of healthcare. The doctors and hospitals remain totally independent, just like they are with Medicare.
If I told you that every one of your employees could get the health care they need guaranteed, that your costs would go down, everyone would pay less and get more, you might be skeptical. But the truth is, most every country in the world does that.
The benefits in Taiwan's single-payer system are comprehensive. You have inpatient care, hospitalizations, visits to doctors, drugs, dental care, free child delivery, dialysis, all of that is paid for. Patients have complete freedom of choice of providers. Taiwan spends 1.6% of its total operating budget on administration. And that is a tiny fraction of what we spend in this country. It's the peace of mind that it gives people, which Americans don't have yet. I hope every American has that someday.
As a business owner and also as a former Republican legislator, I've said that conservatives should be supportive of single payer because it costs less.
Talking with corporate executives, a lot of them, I think, get this. They know what waste is. They wouldn't be running successful companies if they tolerated waste in their production system, and they can see the waste on the healthcare side. This crazy transactional system is costing them money without value.
Business, when they look at the single payer model, will come quickly to the conclusion that it is the least expensive, the most supportive of a free market, and will have the most direct effect on their costs of operation.
The cost to my company and its employees goes down with single payer. Instead of high insurance premiums with high deductibles, there's a simple payroll fee, like we pay for Social Security. My company gets out of the healthcare business.